everyone, and thank you for joining me for my free tutorial on basic healthcare language, or lingo, that you need to know when you have health insurance. A premium is a set dollar amount you pay out of pocket every month for your health insurance coverage. If you're employed, your employer may be sharing this cost with you. For example, one of my previous employers paid 80% of my premium, and I was only responsible for 20%. Premiums are basically monthly health insurance coverage bills. A deductible is a fixed dollar amount a member must pay for healthcare services before the health insurance plan will make any benefit payments. Typically, when a deductible is met, the member only needs to worry about co-payments and co-insurance. Cost sharing is basically the share of costs for health services between yourself and your health insurance company. For example, co-payments. You're responsible for a portion of a healthcare service that's rendered, say a co-payment of $20, while your health insurance company pays the remaining portion of the cost of that service. A co-payment is a fixed dollar amount a member must pay out of pocket at the time a covered health care service is rendered. Co-insurance is another method of cost sharing where the member is responsible for paying a certain percentage of all of the remaining eligible medical expenses after they've met their deductible. Co-insurance rates do vary depending on if a member is using in-network or out-of-network providers. Preventive care is routine healthcare treatment used to help prevent or maintain illness, disease, or other healthcare conditions. Services like this include screenings, routine checkups, and also educational counseling. Primary care physicians who give referrals to their patients on an as-needed basis in order for them to seek medical care from specialists have been termed gatekeepers. They get this term due to some health insurance policies or plans requiring patients or members to get these referrals to see specialists in order for the specialist's services to be covered under their health plan. A PPO, or a preferred provider organization, is a type of healthcare benefit arrangement designed to supply healthcare services to its members at discounted rates by utilizing a network of healthcare professionals and facilities. Some of the great aspects about PPOs is that, one, it typically does not require its members to get referrals from their primary care physicians in order to see a specialist and for those services to be covered, and two, that they typically cover out-of-network service providers as well. A health savings account, or an HSA, is a type of savings account which allows you to set aside money on a pre-tax basis in order to help pay for qualified medical expenses. Typically, one must have a high deductible health plan to qualify for an HSA. Also, any funds in an HSA not used in the plan year can be rolled over into the next year. Another great thing about HSAs is that they may earn interest and that the contributions are tax deductible. Thank you so much for participating in my free healthcare lingo tutorial. I really hope this was fun and motivating for you to get to know your health insurance coverage more, because quite honestly, the more you know your healthcare coverage and you understand how it works, not only will you receive better care, but you'll also save more money. And don't forget, if this was helpful to you, give my video a thumbs up. Come follow me on YouTube at my Kristen Talk Healthcare Edition channel. Also, I've got an ebook out there called Little Miss Know-It-All's Health Insurance Glossary. It's available on my company's website at peoplesconsulting.org, and it can also be found at a slew of other e-retailers, including Apple and Barnes & Noble online. Thanks again and again. I hope this was really helpful, informative, and fun.